Hi, everyone. My name is Jonathan Scatia. I'm a clinical community psychologist by training. For the past 10 years, my expertise has been what's known as implementation science, understanding how ideas get into practice. I've devoted my career to the practicalities of this aim by helping to create and sustain change in the communities in which we live, by improving how evidence is gathered and used. This passion has led me into many different areas with many different people working towards many different goals. Still, a common problem keeps emerging across all of them: accessing and processing the vast scientific literature. Before this presentation, I searched for common terms we might encounter in our work. I capped these results at 3,000 articles. Even with such a high number, we can see from many of our searches like child maltreatment, health equity, and racism, no one person can plausibly stay up to date. There's just too much out there. Although I consider myself a recovering academic, this is not just an academic problem. Many of my colleagues, both past and present, have encountered barriers and challenges when engaging with the evidence. An old friend of mine is a mental health clinician in Center City, Philadelphia, specializing in post-traumatic stress disorder. She wants to provide the best treatment for her clients, but is limited by the time and money it takes to stay up to date with new publications. I have another colleague at the Centers for Disease Control who is an expert in creating federal policy around emergency preparedness. Yet even at the CDC, he has problems with the quality of results he gets when searching for recent research. And consider one of my graduate classmates who is now a program manager at an NGO. He designs and leads initiatives to improve health outcomes equitably on a population level. Yet he also recognizes the time constraints that limit how he engages with the literature. And indeed, this problem is pervasive. Consistent research has shown there can be up to a 17-year gap between when something is published in the scientific literature and when the public at large actually uses it. We cite the statistic so much it's become a shibboleth. Yet this gap creates many cascading consequences. Students may not be getting the most up-to-date information in their classes and studies. Commercial industries may not have an awareness of the current developments and opportunities in their field. And most importantly, patients are potentially not getting the best treatments available because medical professionals don't know they exist. Frankly, the best knowledge is not being used. There is an emerging solution, though. Natural language processing is a set of artificial intelligence-driven methods that analyze text-based data. These methods attempt to extract meaning and context through the words we choose when we write or when we speak. These methods are not as intimidating as they sound. For example, the bag of words approach treats the frequency of words as meaningful. If a word appears more often, it is likely to be more important. Such an analysis can yield the very familiar word cloud. Another method, word embeddings, involves examining the words displayed across the text. We can see what words are similar to one another based on how closely they occur. For example, an article that shows relationships between pitch, ball, red card, and goal is likely to be about soccer. The figure on the screen now shows the top 50 words across 1,700 implementation science abstracts plotted in a two-dimensional projection. We can see close relationships between decision and policy, framework and implementation, and organizational and community. But for this presentation, I'll focus on one specific method: topic modeling. Topic modeling is a method to cluster large groups of documents. A common approach, Leighton-Dirichlet allocation, assumes that topics are clusters of related words and that documents are clusters of related topics. I then ran topic models for 4 of our initial search terms. Clockwise, these are child maltreatment, community resilience, social media, and racism. Each point represents a single abstract, while each color represents a common topic. We can see how different content areas group together. But pretty figures do not always guide and structure thinking. So I then computed the number of articles per topic. Of the 529 articles on community resilience, about 40 concerned coalition planning. We can still go one step further. This table shows the article that was most representative of each topic. Through a series of straightforward steps, we have reduced 529 articles to 35, which are representative of the diversity of articles on community resilience. However, computers do not understand the text like humans do. They simply look at occurrence and co-occurrence of letter sequences. Any NLP process can yield results that are incomprehensible. Therefore, human interpretations are required to reflect upon and make sense of any analysis, like we already do in nearly any statistical process we engage in. To close out, I want to emphasize that by improving engagement with the scientific literature, we can meaningfully influence many more people. My colleague, Dr. Victoria Scott, and I recently published on how these methods can be implemented by you. Yes, you. We have uploaded it into these portals. These techniques are not complicated, and although there is a learning curve, they can be picked up by researchers and practitioners. For more information, you are welcome to reach out to me at the addresses below, and have a wonderful conference.